This is a pretty pain-free treatment, especially in the lower back. It's not an incredibly sensitive area in the skin. Hi, today we're going to be doing some acupuncture on a patient that has some chronic tightness and pain in their lower back. And so we're going to prep the area and then I'll show you what that looks like. So I'm going to pull up here. And the first thing I do is wipe it down with some alcohol wipes to make the surface as clean as possible before we start putting some needles in. Typically, I will end up using 2 alcohol pads or more depending on the size of the area treated. All right, and then to get started with the needle, these are 40 millimeter needles, which makes them about 1.5 inches a piece. Insert them through a guide tube. Line it up into the area. Tap it in initially there, and then push it in the rest of the way. All right, typically, this is a pretty pain-free treatment, especially in the lower back. It's not an incredibly sensitive area in the skin. And so most patients experience just a very light pinch right during the insertion of the needle, then a bit of pressure as I move it into its place. And that's about it. Okay, and that is all the needles for this particular patient's treatment of this case. Now, I will leave those needles in there typically for about 15 to 20 minutes, let the body react to them, and then after that time, we take them out and we dispose of them in a sharps container. They're single use, so they never get used again. And then we stand the patient up and see how the treatment went.